Picking up our conversation around omega-6 and 3 ratios in healthy living, Naturopathic Doctor Dr. Jacqui Fleury joins me with more on the role omega ratios play in overall brain and gut health, and along with some results that we did a couple weeks ago of an omega balance test. Good morning, Jacqui.
Good morning, Chantel. Thank you so much, first of all, for your willingness to participate in this experiment.
Well, really interesting to see those numbers on paper, and it really helps paint that visual picture, what things are looking like. So a little reminder, omega-6 and 3 balance, what does that look like? What does that mean?
Yeah, great question. So what we want to optimize with regards to the fatty acids in our blood is that we want an ideal ratio of the omega-6 to the omega-3 essential fatty acids. And they're essential because we can't produce them in our bodies. We have to consume them in our diets. So we measured your omega-6 to omega-3 ratio, and the ideal ratio should be 3 to 1, 2 to 1, in a perfect world, 1 to 1, omega-6 to omega-3s. And your ratio came back at 15 to 1, so 15 omega-6 to 1 omega-3. So that's a little bit out of balance, and you're not alone. 97% of the world population is out of balance. They're just not getting enough omega-3s to the omega-6s.
Okay, well, interesting to see that breakdown. And I was going to say it does seem on the unbalanced side of things.
Yes. Well, it is, but the good news is, and the whole purpose of knowing this information is to understand what does it mean, and then what do we do about it. So what does it mean? Well, it means that for the most part, our cell membranes should have enough omega-3s that they are flexible and fluid. So good things need to get into your cells, bad things need to get out, bottom line. So if your cells are not as fluid, if you think about your cell as a grape, if you lose your fluidity, then your cell becomes more like a raisin. And so those good things don't get in and the bad things don't get out. And our health is really as good as what gets in and what gets out of our cells. So.
Okay, well, really interesting. And we did do the finger prick a couple weeks ago.
We did.
So yes, those results are in. Now, how can we become more balanced when it comes to the omega ratios?
That is a great question. And again, the whole reason for running this test is to understand that know your numbers and then know how to correct them. And so ideally, we would be able to do this through our diet. But the reality of it is we just can't eat enough fish. Fish is your primary source of omega-3s. You would have to eat pounds of fish every day, and it would need to be salmon and good quality salmon. Little fish work as well, so sardines, but again, I'm sure you're not eating cans of sardines every day. So the next best way to do this is through supplementation, through a high quality omega that is often dosed according to your body weight, because sometimes people will be taking an omega, but they're only taking 1 or 2 capsules or maybe a teaspoon a day. And what I'm learning just from my own testing with my own clients is that it's just not enough. So the only way to know is to test and then to retest.
Okay, so do a little update then and see how the supplementation, or if you're maybe eating more fish in the day. Yes.
I mean, you certainly could try to achieve this through your diet, and by increasing more omega-3s, and also being careful where your omega-6s are coming from. So a lot of vegetable oils are high in omega-6. So soybean oil, canola oil, and processed foods are of course going to have lots of those omega-6s. So of course you can never go wrong with improving the quality of the food that you eat, but really when it comes to correcting a ratio like yours, we will have to be more intentional with the dosing of those omega-3s. And guess what? After 120 days, your red blood cells, your body builds a whole new supply of red blood cells, and that's a really great time to retest.
Okay, well, learning all about omega-3 ratios, supplementation. Thank you so much, Dr. Jacqui Fleury.
Well, we'll see you in 120 days.
Yes, we'll do another update.
You betcha. Thanks, Chantel.